Welcome to episode 4 of the Career Cumulus Spotlight series. Today, Joanne provides us with an overview of the role of a charge nurse.
So what the difference between, you hear all these terminologies, a charge nurse and a clinical manager, is basically the clinical manager has that management position. The charge nurse will be somebody who will do the same thing, but not totally, because they won't do payroll, they won't do discipline, they won't do that kind of stuff, but they are in charge of that unit and being the person who says, yes, this person's assigns patients to this room, or says, you know what, we're going to get this patient out, who gets updates on the patients, who says, well, maybe to that nurse, maybe this patient no longer requires ICU because I see that they've gotten off of A, B, C, and now they're ready to go to that next level because they can come out of the ICU. So I was asked to become a charge nurse, and that charge nurse takes over, like if that clinical manager isn't on that day. You need somebody to cover that. Clinical manager can't do all 7 12-hour shifts.
So is that what
so
the
you
charge
have
nurse?
the charge nurses. You have these nurses that are trained to handle situations. Let's say there's a patient complaint. That charge nurse will go in there and deal with the issue to try to solve it. If there's a complaint from a physician, we go ahead. If there's a complaint from a family member, we go ahead and take care of that, which is what also, so they have that part. And then the only thing they don't do is that the clinical manager does more managerial stuff.
Thank you for joining us today. Stay tuned for our next episode where Joanne will tell us more about the role of a clinical manager, which is a people leader role. Don't forget to like, comment, and share this post, as well as follow us for more career insights.